So pediatrics, if you do all the things you're supposed to screen for, according to Bright Futures, which is kind of the pediatrics Bible for preventative care, I think it takes somewhere in the range of 6 to 8 hours for a visit. And I'm sure there's some hyperbole within all that, but it's true that there just isn't enough time to be screening for all the things. And so if there's something that has the potential to be a Pandora's box, even if it's at the subconscious level, if there's a way to kind of tiptoe around it, sometimes that's natural, normal human instinct. We've done this with depression. We've done this with suicidality. And I think equally so, this is an issue with trauma. It's a little bit of a mixed bag, right? Because pediatricians in general understand their responsibility as mandated reporters when it comes to child abuse. That's not to say that pediatricians do it perfectly and that they report every time that they should. But that is something that really is part and parcel within pediatrics. But you take it a step further and you open up that potential Pandora's box around trauma or around suicidality, and you haven't empowered that clinic to know how to respond. It makes perfect sense that I'm going to take care of the things that I need to do, that the family is asking for. It's a well child check. They want to know, is their child healthy? So I'm going to do that. And I'm not going to go the extra. I'm not going to go down these roads that if it's a no, great, it doesn't wreak havoc on my clinic. But if it's a yes, oh boy, Mrs. Johnson in the next room with the twins, that's not going to go well. It's going to back us up in 3 clinics and I'm going to miss lunch again. So I do think that's a real piece to it. That is part of the reason why I think preparing a clinical setting and figuring out what the responses are so critical to being able to do trauma-informed care. If you just want to do trauma-informed care, but you don't have the systems in place internally within your clinical setting, and you don't have the systems, the connections external to your clinic to make these appropriate connections and linkages, it does wreak havoc on your clinic. That is true. And so it's really important that when you want to develop something that you think about not just how do you screen or how do you start the conversation, but then really how do you respond in an effective, but frankly, efficient kind of way.